Trying to transform healthcare can feel a bit like trying to turn an aircraft carrier on a dime. It's just massive, it's complex, and it feels impossibly slow. But what if there was a playbook? Well, that's what we're going to do. We're going to dive into that playbook and unpack the real-world strategies that successful healthcare systems are using right now to navigate this kind of monumental change. So, first things first, let's just acknowledge the elephant in the room. If you've ever felt just frustrated by the pace of change in healthcare, you are definitely not alone. It's a notoriously tough nut to crack, and that complexity, well, it's rooted in some very real, very big pressures. This slide really lays out the perfect storm that pretty much every system is weathering. We're talking about huge affordability crises thanks to inflation, a massive struggle to find and keep talented experts, and the operational strain from the pandemic that just won't go away. And then you layer on things like the health impacts of climate change, all while the system itself seems to be in a constant state of reorganization. It's a lot. Okay, so you're facing that storm. Where do you even start? Well, our first case study from the UK is fascinating. It shows how one hospital group decided to tackle one of the biggest and maybe one of the most fundamental problems in all of medicine, variation. And Dr. Chris Struther just hits the nail on the head here. When the way care gets delivered is all over the map, it's not just inefficient, it actually leads to worse outcomes for patients. And it ends up costing the entire system more money. Suddenly, the goal became crystal clear. They had to reduce that variation. So how'd they do it? They totally re-engineered the hip replacement pathway. What was once this clunky 12-step manual process, the kind that's just begging for errors and delays, it became this seamless, digitized 6-step process with automated booking. But the real game changer? It went from being completely unpredictable to a system where they could tell a patient their discharge date at their very first appointment. Think about that. And the result of all this? A staggering 25% reduction in the average length of a hospital stay for these patients. Now, that's not just a number on a spreadsheet. That means fewer resources used, lower costs, and most importantly, patients getting home to recover in their own space sooner. Just a massive win all around. So the big question is, how can other people replicate this kind of success? Well, it really boils down to 4 key things. First, it needed consistent, long-term commitment from the very top. The board had to be all in. Second, the solution had to be designed and driven by the clinicians themselves, not just forced on them. Third, it was built on a really sound methodology, and they learned from partners. And finally, and this is so critical, patients were actually part of designing the new process. All right, so that UK case gives us a powerful tactic: standardize the pathways. But how do you decide which changes you should even be chasing in the first place? For that, we're going to look at a model from the US, where a large physician group came up with this brilliant framework they call the 3-legged stool to test out any new idea. This quote from Dr. Jane Fogg is really the heart and soul of their whole approach. It's not about finding a cool new piece of tech and trying to figure out where to jam it in. It's about starting with the problem. What problem are you trying to solve for your patients and your staff? That simple shift in perspective, it changes everything. So this framework is built on a really simple idea. For any new idea to actually stand on its own, it needs 3 strong legs. First, is it clinically desirable? I mean, does it actually improve things for patients and doctors? Second, is it operationally feasible? Can we really make this work in our chaotic day-to-day workflows? And third, is it financially viable? Can it possibly survive in the super complex world of insurance and billing? If even one of those legs is weak, the whole stool just falls right over.
And here's a perfect example of how this framework plays out with something like video visits. The desirability leg? A total slam dunk. Of course, patients love saving 45 minutes of travel time, but the other 2 legs were pretty wobbly. Feasibility was a huge challenge because of all the different state licensing rules, and viability was incredibly tough because of the chaotic world of insurance eligibility and copays. It just goes to show you, a great, desirable idea isn't enough on its own.
So we have a tactic for getting things done from the UK and a framework for strategy from the US. But how do you get these ideas to actually stick? Especially in a culture that is, let's be honest, designed to be cautious and resistant to change. Well, that is all about change management. Dr. Ted James boils this all down to 3 core principles. First, and this echoes what we heard before, you have to design the solution around the core problem. Second, you have to drive adoption with hard data.
In a world of evidence-based medicine, proof is the only currency that really matters if you want to win over the skeptics. And third, implementation can't just be some top-down order. You have to deeply involve the people who will actually be using it right from the very beginning. This all gives us a super practical checklist for looking at any new technology, and it uses the acronym SMART. Is it simple enough that people will actually use it without a ton of training? Is it modifiable so it can fit different teams or workplace cultures? Is the data it gives you actionable, or is it just creating more noise? Is it relevant? Does it offer like a 10 times advantage, not just a tiny little improvement? And finally, can you trust it? Is it secure, private, and validated? Because if not, it's a non-starter.
Okay, and that brings us to the final piece of our playbook. Because you can have the best ideas, the most brilliant frameworks, and the smartest tech, but without the right structures in place to guide the change over the long haul, even the best plans are going to fizzle out. And this is all about governance. So, what the heck is governance, really? Well, think of it as the constitution for your transformation. It's the agreed upon set of rules and processes and structures that you use to set your goals, manage your plans, and decide where to put your time and money. It's basically the operating system for change. And look, good governance isn't about creating more bureaucracy. It's a system that feels objective and fair, so people actually trust the decisions being made. It's efficient, so it doesn't slow everything down. There's crystal clear authority. Everybody knows who makes the final call. And maybe most importantly, it's not set in stone. It has to be able to adapt and evolve as the organization itself changes over time.
So there you have it. That's the playbook. It's about finding those places where you can standardize pathways to cut down on harmful variation. It's about making sure your new ideas can actually stand on all three legs of desirability, feasibility, and viability. And it's about building the governance to make it all last. So this leaves us with one last question to take with you. When you look at your own world, what's the one barrier, the one wobbly leg on the stool that you can start working on today?